Good evening. My name is Randy Hayes, and when asked to define ethics, I like to recognize it as two entities. The first one is principles that will govern a person's behavior, and secondly, it's the actual study, uh, the branch of knowledge that deals with moral principles. Simply put, layman's terms, it's a baseline standard of how to live your life and is usually influenced by location, culture, and economic environment. I believe that this is important because this allows humans to basically operate on a baseline of overall innate goodness, and that's universal, regardless of where you come from or your background. There are basic principles of ethics, but when asked to apply them to my career aspiration as a nurse practitioner, and already being a nurse myself, I know that the nursing model has adopted its own code, and these principles are identified as justice, beneficence, non maleficence, accountability, fidelity, autonomy, and veracity. Out of those principles, I'm going to touch on a few of them that are the most prolific to me and how I would potentially apply them to hypothetical situations that would allow me to create the greatest outcome for the greater good. For example, as a family practice nurse practitioner, I will have to treat multiple demographics of people, varying in ages, beliefs, disease processes. As a family practice healthcare provider, the mission is to manage chronically ill processes, but also to teach and educate the patient on preventative treatment, as to be the stopgap for allowing these diseases to progress to the final or terminal stage. Excuse me. This is when I would give the patient tools and information on how to slow down or even reverse the disease process. This also includes providing the proper education when it comes to vaccinating the masses. Now, for example, if I had a mother who was an anti-vaxxer, which elements would I apply? Now, I think that I would initially apply autonomy. And I feel like this is the most important because it immediately forces me to respect the patient as a unique person who has the right to their own opinions, perspectives, values, and beliefs. Nurses, period, should only encourage the patient to make their own decisions without any judgment, and remember that the patient has the right to reject any treatments. You're not the author and the finisher of how a patient decides to go on with their care plan. Secondly, beneficence, because overall, my purpose is to do what's right for the patient. And lastly, non-maleficence, because I definitely don't want any harm to come to the patient. Using just these three principles will allow me to respect the mother, her ideas, and together, we could make a decision, concerning the child, the best thing for that. Also, in a second example, what if there was a patient who was 41 years old, female, terminal stage of cancer, stage 4, very progressed, metastasized. She's looking, terminal. The whole healthcare team knows that she's been mentally delayed since birth, but this patient now, whom we all know is mentally delayed, is adamantly requesting to stop any further treatment, life-saving treatments, chemo, that sort of thing. Which of those ethical elements would I apply in this decision? Just because she's delayed, with autonomy being what I would apply initially, it sticks out, greatly because it's her autonomy compromised since she's delayed. And just because she is delayed, does that mean that she can't understand the full implications of what it means when the life-saving treatment is ceased? How would I gauge her capacity? And who would decide if that capacity is sufficient enough to make that decision? This can only bring me back to the Socrates quote of one thing only I know, and that is that I know nothing. So the only thing that I can do is apply veracity. And that obligates me to objectively give her evidence-based claims on her condition and probable outcomes. Then, together, myself and her healthcare team will have to come together and respect whatever is the most ethically correct. Excuse me. These two examples pinpoint a broad spectrum of ethical issues that arise in the medical field. But the one thing I appreciate most about the nursing model and its ethical approach to dealing with these issues are to assess the person, including what else may be affecting this person's ailment or emotional disposition. Doing this will allow you to empathically heal the patient versus just the ailment. Thank you. Again, my name is Randolph Hayes, and I appreciate you taking the time to view my video. Good night.